Hello and welcome to the Logic Box with me, Jones. Hope you're well and safe. This is actually our first podcast of the year 2021, and there's been a lot going on, so we decided to take our time to get things in order, get our house in order, and finally come to you. And I'm actually excited because today is our first podcast, and not really excited about the subject matter, but I'm excited because I remember the first time we spoke about this particular issue, COVID-19, it was with Dr. Adwoa Danso. And we have her again. So, Dr. Adwoa Danso, thank you very much once again for coming on the Logic Box.
And yeah, it's interesting that you say, that was a long time ago, wasn't it? When I was first on the show.
A year ago.
And I think the show, when I was on the show, there were just a few cases.
One case.
Was it one case?
On the tube, yes.
On the tube, and we talked about that, I think. Yeah. And it was I just can't even believe that was such a long time ago. And I can't actually believe that we're in this scenario because, honestly speaking, when we spoke last, I think even what I was saying, I'd probably look back at it now and think, oh my goodness, but that's just the way things go sometimes.
Yeah, absolutely. Because I remember when we started having a conversation, I think everyone was talking about the mask and how safe it was and how effective it was. And then we had the panic buying, and then, toilet rolls going out of stock. And now, so here we are, a year on. And, sadly, we've lost a lot of people to COVID. But yeah, unfortunately. And but today, I just want us to concentrate really on the vaccines. And, there's been a lot of myths about the vaccines. And I'm sure, let me give you a little plug, because I know coming Friday, Ghana Union are putting together, a panelist full of medical experts who will try and engage with the community to encourage them and to also dispel any myths about the vaccines. So there you go. Make sure you do tune in. But I also want us to look at the myths and also what the vaccine actually does when it enters into your body. And also, because I'm part of a WhatsApp group. And funny enough, it is, my old schoolmates that I went to school with. And, as you grow up, everybody finds their own way. And, some people evolve, that they don't follow the same path you all did at one particular point. And then you tend to realize your views kind of differ on some issues, which, I don't mind. But the moment it starts to, go down one trajectory and it's just it becomes anti-vaccine, anti-government, anti-establishment, then you need to start questioning things. Okay, so now I want us to talk about the vaccine. And to my knowledge, you've had the vaccine because I think you posted it on your Instagram.
I had the first dose of the Pfizer vaccine a few weeks ago now. I'm actually due to have my second dose this week. So I think part of it is actually to talk about my experience maybe of having the vaccine, and maybe kind of the lead up to that. I can talk about that now if you wanted.
Yes, I want you to, because clearly you're still here, you're alive.
Yeah, I'm alive, I'm kicking, I'm doing really well. So with regards to the vaccine, so I'm a GP for those that may not know. I'm classed as a frontline worker, so I was eligible to have my vaccine. Now, it's important to say that I didn't know what vaccine I would be having. I didn't know until I got there. And I'll be honest with you, I wasn't really bothered. I wasn't bothered about which vaccine I was going to be given, because having read all of the literature and read looked at all the research, I was quite happy that with either of the vaccines, I would have a decent amount of protection. And, they all ultimately protect against death. and they protect against hospitalization. So for me, that's the most important thing. I don't want to die, and I certainly don't want to end up in hospital. So I wasn't necessarily too bothered about what type of vaccine I had. But yes, I had the Pfizer vaccine, and I had my first dose. So I was a little bit apprehensive about having it, just because I wasn't sure what to expect. There was a lot of things in the press as to be expected, and it was a different type of vaccine which works with a new technology. So it was really exciting as well, to kind of be one of the first people to have the vaccine. And I think what was important was just to kind of go through the process. First of all, it all happened extremely quickly. From the moment I entered to when I actually left, it probably took about 20 minutes in total, and that includes about a 15-minute observation period. So I went there, and they confirmed my name, my date of birth, and when I was there, actually I was only the probably the youngest person there, because lots of over 75s who were having the vaccine. So I think most people assumed that I was a healthcare worker, because I was quite young anyway.
Yeah.
So yeah, they confirmed who I was, and then after that, I moved on, and I had a sort of went through a checklist with a doctor who basically is trying to establish whether I am currently fit to have the vaccine. Are there any reasons why I couldn't have it? So they asked if I was pregnant, if I had any reactions in the past, if I'd already had the vaccine, and then I was given the go ahead. Went straight to another room and was given the vaccine. And then after that, I was moved to another room where they observe you for 15 minutes, which is part of the protocol. So you basically sit there for 15 minutes, and then you are free to go. Now, with regards to side effects or any adverse reactions, which I think is kind of what most people are anxious about, I had actually...
Yes, and that was going to be my follow-up question anyway, side effects.
So I'll be honest with you, I was ready, almost like in anticipation. I was ready for anything. So I was expecting to have a whole array of side effects. I took some paracetamol as I got home, because I don't know, I was just expecting something to happen. I don't know why, but nothing happened. I had a bit of a sore arm for probably a day, but I certainly had worse pain from a workout. It wasn't anything. I was able to function, I was able to drive, I was able to go to work. I was completely fine. So going into the second dose, which I'm due to have towards the end of the week, I have hardly any reservations. I just, I'm quite glad after the second one I'll have almost I'll be covered by a sort of 95%, which is brilliant.
Okay, so if I'm going by your story and your experience in having the vaccination, and the vaccines are not designed to exterminate Black people.
No, they're certainly not. And I have to be really careful when I answer this question, just because I don't want to, I think sometimes in the press and the media, it's almost as though, Black people are not stupid people. We're not stupid. We don't come to these conclusions from nothing. There's a strong history of medical racism which exists, unfortunately, and there's also a very strong history of Black people being mistreated. So it's not as though people aren't are hesitant for no reason. People are hesitant for actually good reason, and it's COVID-19 has shone a light on so many already existing health inequalities that exist, that already affect our community. So for Black people, this isn't really anything new to be to be a community that's more affected, to be a community that has poorer outcomes. This is not new for us. We have long been subject to poor outcomes for a long time. So you have to be able to understand that and and think, well, actually, there's lots of things that can make us feel can make us feel less trustful of the government and of systems in general.
Okay, well, speaking to a lot of people, because I keep getting this question a lot, Doctor Jones, are you going to take the vaccines, and if it's offered to you? And my response has always been, I've been doing my research into it. I've been speaking to people. One particular person who had it as well. I'm sure she won't mind me mentioning her name. Jennifer, a very good friend of mine. She posted it on her Instagram today that she's had the vaccine. She's fine. She feels great, and she's really happy to have it. What do you think needs to be done, Doctor, to really drill home to people that this vaccine is not something that will put your life in jeopardy? It's not anything that is looking to kill off black people, so to speak.
Yeah. I think it's important to understand, first of all, how it works. So the virus itself is not being injected. How it actually works, simplified, is basically you are injecting something that can. So basically, you're waking up your immune system. So you're giving out information to your immune system to say, look, this is what COVID looks like. This is what the antibody should look like. Be ready and start making this just in case you come into contact with it. So the actual virus is not given out. So that's the first and foremost thing. I think the other thing to mention is that just be aware of false information and misinformation. As well. And I think also media has a role to play in this too, right? So when we first saw the people that were having the vaccinations on TV, I didn't see any black people having the vaccination. I saw lots of elderly white people, and I think I saw an Asian man a few weeks later or some days later. I didn't see a black person having the vaccine. So I think that subconsciously that has an effect as well. But there are lots of black people having the vaccine as well. So I think that's important to bear in mind. And also, I think you have to make a decision for yourself. Don't be led by others in these instances too. And I think, ultimately, the only way that we're going to be out of this situation is if we have vaccine. There is no way that we can move forward. And like you said, Jones, we talked about this at the beginning.
Yeah.
And we really are in a much worse position than we were when we spoke. And like you said, people have died. People have lost their parents. People have lost their colleagues that they work with. Like, this thing is very real. And the only way that we can get some kind of normality back is to be vaccinated. And we need a large number of people to be vaccinated as well. And I think, to answer your question about how can we kind of go into these communities to try and increase the uptake, because it's 72% of black people have vaccine hesitancy, which I hate. I hate all sorts of terminology. I don't like that terminology either. Because it's not I don't know, but it's there for a reason. But I think we also need to have our communities our community leaders to try and also have some influence over over the community. So places of worship, I saw on the news yesterday as well that some mosques are opening up to act as a hub for people to have the COVID vaccine. We need a lot more of that as well. And
I mean, if I may interject, I think it's going to be very difficult, because I have seen some pastors actually preaching about COVID-19 and talking about how it has been manufactured, and it is the end time and it's all a conspiracy, and so it's going to be very difficult to.
No, I definitely think it will. I definitely think it will be a challenge. But I also think that when you look at the number of people that are potentially going to be, for example, on the Ghana Union Zoom conference call, there's a lot of people. So, there's people that can perhaps change their minds, or actually who just don't know enough to make a decision. So it's not that people are hesitant; people just don't know enough to make decisions. So we really need.
It's a fine line, isn't it, when it comes to your faith and also what the doctors say, because most of the times when you go to the hospital and one gets diagnosed, the first thing, if the person is a religious person, is, I rebuke that, wherever it is.
Yeah, yeah.
So for going to hospital and going to church and praying against, COVID, and then being told that go for the vaccine by the medical experts, and then you have, on the other hand, your religious leader telling you to do contrary to what the medical expert is advising you to do.
I'll be honest, I really do think that's a small number of people. I'm a Christian myself. There's definitely a role for religion and science to work together. I'm a strong advocate for that. Interestingly, I actually saw my pastor today for a completely separate matter, and he was so intrigued about the whole vaccination process and couldn't wait to have his own vaccine. So I think as well, like, we're more likely to talk, like we are now, we're more likely to talk about the very small number of religious leaders who are not advocates for the vaccine, but actually the majority of religious leaders within the community understand the impact that COVID-19 has had on their community, that they see the benefit of their congregations, the communities taking up the vaccine.
Okay, let's talk about the efficacy of the vaccines. Today in the newspapers, it was reported that AstraZeneca is not that effective when it comes to the new variant of. You were saying you hate what did you say? Taglines where they call it the South African variant. Come on, what is South African variant?
Well, and I think that's another thing, but I've got to be really careful. So
I just want to talk about the new variant and how it differs from the COVID itself.
Yeah, so with all viruses, and this is not a new concept, viruses, they want to survive, they want to breed, and they want to be around, right? So what they do is they mutate to try and kind of, escape extinction, basically. So it's like the cold flu, the cold virus or the flu virus. Just because you've had one cold in your lifetime, it doesn't mean that you're not going to have another one, because the cold virus is very smart. It knows how to mutate so that it can hang around. So it actually says, I'm going to change this part of me so that your body doesn't actually recognize it, because they recognize the old virus. So it's very similar to that. So because the COVID virus has been around, it's had time to kind of get smarter. It's had time to change how it looks so we don't recognize it. So it's more likely to infect more and more people, which is what's happened. So the variant isn't a new concept. Variants and mutations of viruses are what we see. It's what we expect of viruses, which is why, and we always knew this was going to happen, because that's what viruses do, which is why it was so important to try and, stamp out the virus as quickly as possible. But unfortunately, for a number of different reasons, that wasn't possible. So yeah, it's a variant which happens. We know that there's more. We're kind of doing a lot more trials at the moment to see whether the other vaccines are just as efficacious as the other ones. So it might be, I was reading that it might be that those people that had the AstraZeneca vaccine may need a subsequent booster later on as well, which is possible, which is also not a bad thing either. Like I said with the flu vaccination, you don't just have one flu jab, you have to have it every year, because it keeps mutating, and there are lots of different types of flu strains. So yes, that's pretty much what they have said at the moment, but it's so new, there's more and more information coming out.
And also, one question that a lot of people keep asking me is, so you've kind of touched upon it really, but people keep asking, so if they go for the vaccine, does that mean that they're cured from COVID?
Yeah, not necessarily at all, because of the mutations, because things may be changing, but it gives you a very high percentage chance, so over 90% chance for all of the vaccines, that you will have protection against COVID. And we also know that if you were to catch COVID after you've had your immunizations, the chances are that your symptoms would be milder, and it wouldn't necessarily result in death or hospitalization, which is really what it's all about.
Interesting. I mean, I wanted us to have this discussion because these questions keep coming up, and especially within our community, to inform people. Sometimes we kind of get secondhand information, and there's a lot of misinformations going out there, especially across social media platforms, on WhatsApp. I was listening to one particular radio station. I won't put their name out, and somebody came on and made such a ridiculous statement, or in my opinion, and said that they will not accept the vaccines. This is not for black people. The usual stuff. And I felt at that particular moment, it would have been a great idea for the journalists to get a medical expert on to enlighten people, give people insight. Because I think in our community, especially, it's down to lack of, education and people really explaining what it actually means.
No, absolutely. And I think with you see, because this has happened in an age where there's so much access to information, everybody feels that they're an expert to an extent, which sometimes is good because you want people to have the information so people don't feel that anything is a secret. But also, you have to question yourself sometimes about who is giving this information. I was actually speaking to a friend of mine. You have to yesterday about some sort of other things where people have been asked to speak on things that really isn't their remit. It's like me being asked to, although I'm a doctor, if I was asked to go and stand up and speak about the newest technologies in prostate cancer removal, that's not really my field. I would call on somebody who was more of an expert in that field. So it's like trying to understand who is giving you this information and understand their limitations, but also understand your own limitations. Like you said on the radio show, you need to have some sort of balance, because if opinions are going unchallenged, you just don't know who's listening to that and who's going to go away and form an opinion based on somebody who's just doesn't have the knowledge.
And I mean, since the vaccines have been rolled out, in your line of work, have you had more people coming to you to ask questions and actually changing their mind to go on to have the vaccine?
Do you know what's really interesting? From the beginning, when there was, towards the end of December, beginning of January, when we were becoming very close to rolling out the vaccine, at the GP surgery, we were inundated with phone calls for people who were so desperate to have the vaccine, who wanted to know when they would have the vaccine, where in line were they to have the vaccine, because people just want their lives to go back to normal. And also, those are the people that you don't hear about. You don't hear that people are calling the GP surgery trying to get the vaccine. You only hear of the people that don't want the vaccine. But a large number of people want the vaccine, and a large number of people at our surgery have had the vaccine as well. So I think people want to know more about it. I've had lots of really great discussions with patients about efficacies, like we are today, talking about adverse effects, and they're all really great questions, because you just want to have all the information you can to make a decision about the vaccine. And also, I think it's also knowing what to expect as well. Like I said, I'd read so much that I really thought I was going to have all of these adverse effects, and I was kind of ready for everything, which maybe I probably shouldn't have looked into so much, because I think it made me more anxious than I probably needed to be. But yeah, I think just having the information to make a decision and knowing what to expect, I think a lot of it is the fear of the unknown. This is not the first time that we've had vaccinations that have just been brought out, BCG. Everything started from somewhere. But I think it's probably the first time, and it's the way it's happened, that it's just so in the public domain, and for good reason as well, that, people, there's a tangible feeling of excitement and anxiety.
No, you're right. I was just about to say, and, you said it perfectly. We also have to look at the fact that at the rate in which people are dying, is a new virus. Nobody knew what was happening, and people were dying left, right, center. Even last year, when we spoke about this, we only had one case here in the UK that had
And we
been
were talking. We
reported.
talked briefly about Ghana, didn't we? We talked about
Yeah,
how is Ghana going to cope? How is
yeah,
Ghana going to cope?
yeah.
Well,
Yeah, and
interesting how it worked
and I
out.
mean, look, it's good for people to do the research. It's okay to feel anxious about it, but I just want us to talk a bit about the side effects, because obviously with most medications, unless I'm wrong, feel free to correct me. There is side effects to every medication, most
Yeah.
medications
So
anyway.
yeah.
But it doesn't necessarily mean that you will experience those side effects.
Yeah. So I think with all medicines and vaccines in this country, there are, there's a procedure of how we test vaccinations. There are steps and very stringent rules for how we test vaccinations. So it's tested on increasing numbers of people, depending on their effects, they increase them slowly, and they're basically essentially there to assess safety and effectiveness. And an independent regulatory body is responsible for overseeing this to make sure that it's safe. If it fails in any of the steps, it doesn't proceed. So that's the first and foremost thing. Now, with all medicines and vaccines, there are a small chance that you may have some adverse effects. Now, we call them adverse effects because they're not necessarily dangerous, but they're things that are as a result of the medicine or the vaccine. So with the COVID-19 vaccine, there are a number of very common adverse effects. Like I said, I mentioned one of them that had happened to myself, which can happen and often resolve by themselves with, in the first 24 to 48 hours. So the most common adverse effects with the COVID-19 vaccine are soreness of like muscle aches and soreness. You might get some redness and soreness at the injection site. You also might get some fatigue and tiredness as well. Now, and in an even tinier, tiny number of cases, people may have an anaphylactic reaction, which is similar to what people get if they get stung by a bee or with certain medicines. So far, we haven't seen many cases of this, but there are also very strict guidance about who can have the vaccine. So people that have any allergies to any of the ingredients of the vaccine are strongly contraindicated to having the vaccine. Initially, it was mentioned that people that had previous history of food allergies and medicine allergies were not allowed to have the vaccine, but this has been changed more recently as well. So it's always best to discuss with your GP if you're unsure about whether you can or cannot have the vaccine. But as I said, speak to your GP. In most cases, most people are eligible to have the vaccine.
And before I let you go, what about the the herbal remedies?
Well, maybe my question is, what about the herbal remedies?
Because there are some people who feel as though so long as they take the herbal remedies, they don't need to get vaccinated.
Well, I think the way I look at these things is I try and be really logical about it, right? So if the way I see it and what I say to myself is, if the herbal remedies were really the way forward, surely it would have been a much cheaper, easier process to make those herbal remedies into some sort of vaccination, and then we'd all be great and fine. But that's just not the case. So I would just say, look, there is an aspect of medicine is derived from herbs, from chemicals, from things that exist. Some of the drugs that we use today came from plants and from herbs, but I just think it's not as simple as that. And I think if you want to get real protection from COVID, you need to have a vaccination. There are no herbs that we currently have evidence for that work in that way to protect you.
And finally, from you, Dr. Adwoa Danso, in terms of COVID, people following the guidelines and protecting themselves, what would you say to our listeners?
What I would say is, so far the case the cases are slowly reducing. They have reduced before in the past, but this has been a really long process. We are nearly towards the end of the finishing line. There is some light towards the end of the tunnel. We have to just stick with it, because we all know that things can change really quickly. We just have to stick with it. If you are offered a vaccine, really, really think about having it and taking the opportunity. If you have any reservations at all, speak to somebody, speak to your healthcare professional for further advice. But yeah, hang in there. We are almost through.
Dr. Adwoa Danso, thank you very much for taking time out to talk to us. As my pastor said, look, this coronavirus is very real. Even with paracetamol, some people might have side effects in taking paracetamol, and paracetamol is probably known as the safest medicine out there, Doc. If I'm wrong, correct me. But there are people who also have side effects from it. So I would like to say, whatever it is that you do, make sure, as Doctor said, if you have any concerns, speak to your GP, do your own research, and stop listening to what everybody's trying to bombard you with. It's okay to look into things, but also the best way to move forward or to make your own decision is do your research. Thank you, Doctor. Thank you. It's been a pleasure talking to you.
Thank you.
Thank you.